This short presentation will guide you through pelvic floor muscle exercises, helping you to identify the right muscles and informing you how to effectively strengthen and tone this important group of muscles. Please read this disclaimer before continuing. It is important to be able to identify the correct muscles before you start to exercise them. There are several different ways that you can try to locate these muscles. Imagine that you are trying to stop yourself from breaking wind by tightening the muscle around your back passage, and at the same time imagine you are trying to stop the flow of urine, tightening the muscles around the vagina and the urethra. And then imagine that you are trying to lift these muscles up from the chair beneath you. So the overall movement is a squeeze with a gentle lift. Ideally, the bigger outer muscles around your hips, your inner thighs and your buttocks should remain relaxed when doing an isolated pelvic floor contraction. There are several ways to help you to identify the correct muscles. Maybe use a mirror and look at the perineum as you're doing your pelvic floor contraction. You should see a tightening and a lifting. Place your finger or your thumb on the area between the vagina and the back passage and feel the lift as you squeeze your pelvic floor. Place a finger or thumb inside the vagina and feel the muscle tighten around your finger. Try to stop the flow of urine when on the toilet. Once only, just to help you to identify the correct muscles, and this should not be done regularly. Okay, so let's practice. Sit comfortably in your chair with your feet on the floor with a nice relaxed belly. Take a breath in, and on your next breath out, squeeze and lift your pelvic floor. Hold that contraction and then relax and feel the muscles flop back down to the start position. So firstly, let's practice some long, slow holds. These exercises will train the endurance of your muscles. So take a breath in, and on the exhale, tighten and lift your pelvic floor. Hold that contraction for as long as you can, making sure that you are not holding your breath. So count in seconds. When the muscle starts to tire, relax and feel the muscles flop. Rest for the same amount of time and then repeat as many times as you are able to the point of fatigue. Next, let's practice some quick squeezes. These train the speed and the strength of your muscles. So when you're sitting comfortably, squeeze and draw up your pelvic floor muscles as quickly and as strongly as you can, and then fully relax. Repeat this as many times as you can before your muscles tire, and this is the number of quick squeezes that you can do in one go. We recommend that you try to do your exercise program about 2 to 3 times per day. Vary how you do your exercises, so try doing them in lying, sitting and standing as you feel able. Try to do them at a time when you can fully focus on your exercises without distraction. Ideally, doing your pelvic floor exercises should form part of your daily habit. To help you develop this habit, try to find a trigger, such as standing in the shower, sitting on the toilet after passing urine, before rising from bed in the morning, or waiting for the kettle to boil. A small note stuck on the wall next to the toilet roll, the shower, or the kettle will prompt you to remind you to do your exercises. There is a handy app from the App Store called Squeezy, which was developed by women's health physiotherapists, which is a great tool to help you to develop this habit. It takes an average of 66 days to form a new habit, so try to stick with it. The pelvic floor habit should be a habit for life. Remember, it can take 3 to 6 months to see the full benefit of the exercises, so stick with it. Don't give up before they start to have an effect. And again, this is an exercise for life. Think of it as a maintenance program, a bit like brushing your teeth, a regular activity to keep your pelvis healthy. Please read this disclaimer.